Ridge augmentation, sinus lifts, bone grafts kind of all fall under what we call regenerative therapy. We're trying to regrow what the disease has destroyed because you need to have a certain amount of bone to be able to place an implant. And due to either periodontal disease or possibly infection that you had, tooth fractured below the gum and they have to remove bone to get the tooth out, then we're going to have to rebuild some of that bone because the implant is essentially a tooth root that goes in the bone. There has to be adequate amount of bone to place that to make it stable, just like a tooth is stable. So what we do is we'll place bone in a socket and new bone will grow. Sometimes that happens on the upper jaw and there's a sinus there. So that's a limiting factor. We can't put an implant in the sinus. So we do a procedure called a sinus lift. We gently raise the sinus up. We add bone kind of to regenerate that bone to increase the height of bone. And then that allows us to place the implant. Sometimes again, we're able to do that at this time of the sinus lift. We can place the implant. Very rare cases we can't, but we will look at a CT scan and be able to determine that. So you'll know before we go in, yes, we can do this, or no, we can't. It's going to take this period of time or longer.